Hello everyone. In this session, we are going to discuss a very important disease that is Wilson's disease. In your university exam, you can get a long question, but more frequently you get a short question on the pathogenesis and triad and clinical features of Wilson's disease. So let's start. Here you can see we are starting the Wilson's disease. So first of all, I will let you know the overview, the headings under which I am going to describe this disease. So first of all, I will let you know the introduction. What do you mean by Wilson's disease? Then we will see the most common age in which it is presented. Then most importantly, we will see its pathogenesis, the mutation, the pathogenesis, the everything. Then we will see the clinical features. Among the clinical features, the three important clinical features that makes the triad of the Wilson's disease, and finally the diagnosis of Wilson's disease. So if you are getting a long question, you have to frame your answer under these headings. But if you are getting a short question, the question will be either on pathogenesis or on clinical features or on triad. So you have to write down that portion only in short or very short question. So let's start the introduction of Wilson's disease. What is Wilson's disease? Wilson's disease is a hereditary disease. The inheritance is autosomal recessive. It's the autosomal recessive disease. It's the autosomal recessive disease. It occurs due to mutation in a gene. The name of the gene is ATP7B gene. It is present on chromosome number 13. We know that in humans, in human cells, the nucleus of the human cells, it is a diploid. Human cells are diploid, and how many chromosomes are there? Total 46 chromosomes are there. Instead of saying 46 chromosomes, say 23 pairs of chromosomes are there. So this is pair number 1, pair number 2, pair number 3, pair number 4, likewise. So we are talking about pair number 13. On pair number 13, there is a gene. The name of that gene is ATP7B. This is the name of the gene, ATP7B. It is present on chromosome number 13. This is mutated. Because of mutation of this gene, there is impaired excretion of the copper into the bile. Normally, the copper we consume in the diet, that is excreted in the bile. But now the copper cannot be excreted in the bile, and that will accumulate. That will accumulate in the liver, and that will be spilled in the blood and cause toxicity of various organs. So that disease is known as Wilson's disease. Basically, Wilson's disease is copper toxicity. It is copper toxicity. You can learn simply like that. Now, the most common age of presentation, it occurs in children and young age. So it occurs 5 to 30 years of age. The most common age of presentation is children and young adults. So that is the age of presentation. Now, to understand the pathogenesis of Wilson disease, first you must understand the normal metabolism of copper. So we all consume copper in our diet, yes or no? So you can see here the copper is taken in the diet. So via oral route, the copper is taken. Just suppose I am eating copper, I am consuming copper in my diet. So copper will go in my mouth, in my esophagus, in my stomach, and in my intestine. So this is the copper. It is going in the mouth, it is going in the esophagus, it is going in the stomach, and it is reaching the intestine. From the intestine, it will get absorbed and reach in the blood. So from the intestine, it will absorb and reach in my blood. In the blood, you can see this is the copper. It binds with albumin. It will bind with albumin. So this is albumin. It will bind with albumin. Okay. Now this copper will get absorbed and go in the liver. So this is the hepatocyte of the liver. Can you see? Inside the liver, there is a cell. The cell is hepatocyte. So copper get absorbed in the hepatocyte of the liver. Only copper is going, albumin is not going. After going inside the liver, in the hepatocyte of the liver, this copper combined with the protein. The name of the protein is alpha-2 globulin. So copper combined with alpha-2 globulin and forms ceruloplasmin. So free copper is toxic. So we are converting the copper into ceruloplasmin by combining copper with a protein which is present in the liver. The name of the protein is alpha-2 globulin. But for the combining the two things, that is copper and alpha-2 globulin, we require an enzyme. The name of the enzyme is ATPase. And for the synthesis of this enzyme, we require a gene. The name of the gene is ATP7B gene, present on chromosome number 13. So I am having this gene on my chromosome number 13. Okay, so in my liver, in the cells of the liver, in my hepatocytes which are present in my liver, on the 13th chromosome, I am having ATP7B gene that is synthesizing an enzyme. The name of the enzyme is ATPase. So whenever I consume copper, the copper get absorbed. From the intestine, it will go in the blood. From the blood, it will go in the liver. So whenever the copper is going in the liver, so in my liver, there is a protein alpha-2 globulin. So copper combined with alpha-2 globulin and forms ceruloplasmin in presence of enzyme which is known as ATPase. So I'm having